Um, First item we'd have on the agenda is presentation from Appleton Area Health Services.
Good afternoon. I brought the balance scorecard, so I'm just going to pass this around. I probably have to share with that.
That's okay.
We can share.
More important for him to have.
Well, there's
Oh,
Keep it going.
So our days cash on hand is at 13, which is under our goal of 45 days, but it's the way we calculate it. We calculate it based off of operating in our operations account, and we still have our bond money and meaningful use money and grant money that we got. So that's not meeting our expectations, but if we were to recalculate it a different way, it would probably be around 84 days cash on hand right now. Some of it would be restricted though. Total margin, we're meeting our goal at 13%. Accounts receivable is at 45 days, which matches our goal. On the next page, inpatient is not where we want it to be at 85%, but it is above the MRHC average, and so our inpatient's getting 55.6% for customer satisfaction. Our outpatient, which is the blue one below, is at 88.3%, so we are meeting the or at least our expectations. The next page is quality. The Minnesota indicator report, the state average is 21.97, and we're above that at 26.95. Understand my health management. The first quarter we were at 100%, and we took a beating there at 33%, and the nursing staff is looking at ways to hardwire it in there so that the customer, as they leave the facility, understands their discharge planning stuff. The next page under growth, our swing bed days, again, we're above 40, we hit 70. Our surgeries are still down, we'd like 18 a month on average, we're at 11. Our bone densities we would like at 10 a month, and we're averaging 4 right now. Clinic visits is fairly close to our goal of 12, we're at 11. CTs, we'd like to see that a little higher at 96. Chargeable lab tests, it's creeping up there, but we want it at 8,000. Home care visits, our goal is 650, and we reached 668, so we've met goal there. Care center occupancy, which is 96.9%, and then our apartment occupancy at 25 is where we want to be with that. And then finally, our people page, employee turnover is at a very low rate at 3%, and our goal is to be below 15, so we're doing quite well with that. However, it might move up a little bit because we've had several retirements over the last month and a half. So, and then our attendance for the employee forums is at 71%, and we just reiterated to staff that if they don't get to the meetings, to watch it online, let their manager know so they get credit for it. Is there any questions in the balance scorecard?
QHR. Where are
That
we
comes
at?
up next year. So
What do they do for us anymore? Anything really?
they give us a little bit of advice. They do perform some tasks. They set up set up our compliance program for us, helped us do a mock survey. They work with Annie on the contractuals every month.
Do they come out much anymore or not?
We haven't seen a representative from them for 2 to 3 months now, I think was the last time they came out. So, but we've talked about it at the board level that they approached us about the possibility of extending that contract for a lower amount. But after we discussed it at the board level, there just wasn't a lot of support. So we're going to wait until we get closer to the end of the contract to see if we're going to renew it.
what is your savings in that thing? Is it basically in supplies or what? I mean, by having them on call, so to speak.
QHR?
What?
You mean QHR? I guess I don't understand the question.
Well, what's the point of you, I know you gotta extend it until it's legally done.
Okay.
But after that, it's over unless we sign it again. So why do we wanna sign it again? I don't care what the price is.
I think the question is that when they were talking about $150,000 a year saving like on supplies, they didn't come anywhere near that if I remember right, did they?
No. Their value statement, we were kind of chuckling about that because the numbers that they were pulling out came out of the air.
So where do you think, as far as supplies? What would the percentage be or the dollar amount?
Well, we'd be able to turn in, join a different GPO. I don't think that they actually saved us anything because most of the GPOs are pretty much the same. The bigger the GPO, the better pricing you're gonna get.
Yep.
So we can go through aging services for free to get a GPO, or we can sign up with a Marinette. There's several of them out there that we can go through. So it's not like QHR is the only place we have to go.
When is that contract up?
It's next, I think it's next July.
Next July, yep.
Yeah. Mhm.
So basically, we have just a little over a year left.
Are there resources though that they can be using them and calling and asking questions or getting advice?
Oh, yeah. They do. I mean, Annie works with the
But I
financial.
mean, like
peop-
other department managers or units, I mean, are
Well,
they
they're-
utilizing the?
They're doing a couple of audits for us for lab and X-ray, and again, I don't know what the value is. It's just something that they throw out there, and as long as it's inside the contract, we can order that. Do we have to use it? I mean, they wanted us to do a clinical audit, and it's like, I come from a clinic, Judy runs the clinic. It didn't make any sense. It's like, we're not a high-volume clinic, so if you're going to try to put lean principles out on the lean clinic, well, yeah, you could do that with the supplies, but you can't really do it with the people if you don't have the volume.
But
if
are
you-
they offering services to help different departments? That's what I'm asking. Is QHR, like if you said the clinic, like if she's needing help with getting numbers or staffing issues or something like that,
We-
do
no,
they
we-
resource for that?
No, they're not. They're just more of an analytical consultant group for us. Now, in other organizations, the CEO and the CFO are employed by QHR, and then they treat those organizations more like their own because they have direct direction over those two people. So for us, basically, we go, and every month we do this thing called a MORE. It's the Management Operations Review. And basically, I spew out the information that I tell the board, and that's all we get from it. They just get to understand where we're at and how we're operating. But they have no big influence on any decision-making that's made there. Not much in the financial, other than the, calculation of the contractuals. So, I guess I wasn't here when QHR came in, so I don't really want to say whether I feel it's a value or not. But I think that, talking to the board at a board meeting, I'd feel more comfortable being able to let them know how I feel. Does that make sense?
I guess my concern is I'm just, we're paying them all this money. They should be doing checks and balances to make sure that things are where they're supposed to be.
Well, they take in all of our information and they put it in this, it's not a spreadsheet, but it's in a format that compares us to nationals and compares us to other organizations within their system. And it just basically spits out information, but we never really go over that because, and I don't even know why. I don't even know why you get it. It's got so much information on it, and I'll look at it every once in a while and say, well, why are we so much lower than this facility or the national average? And part of it was because of where the hospital was, because their financials were hurting, so they were low there. Where like our cash on hand, the way we calculated at 13. Most hospitals' goal is to be at 100. So it's where your margin is at, where your inpatient days to not inpatient days, resident days to worked hours, things like that we can look at. But most of our stuff is in line. So I don't know. I mean, they don't really offer a lot unless we ask for it. And since we don't ask very much, we're not getting anything.
Should we be asking for more?
That's debatable. I mean, offline I can show you what I'm talking about when you're at the hospital, and I can tell you how the process works, but it's more complicated than trying to explain it here. I'd have to get the sheets out and show you, and I didn't bring any of that information with me.
Well, I'm just, looking at the balance scorecard, and if there's some of these that are consistently, below risk or, below target, are those things that they could help with or give advice or come out,
Well, the ones that are below target, like the when I go to the quality page and I look at understood my healthcare management needs when discharged, the quarter before we were at 100, the quarter after, we're at 33. And we had 8 surveys that came back in, so 33% of, we missed something in those 8. So basically, the DON and the discharge planner have to get together to hardwire a system in so that they ensure that everybody that leaves the facility and being discharged will put down 100%. So QHR can't really help us with that because it's our own process that we're putting in place.
Well, but
could make
QHR can give the DON information of how to improve it. Is your staffing appropriate? Is the EMR system at the potential that it can be to help the nurses get the education through to the patient? You know, I guess I'm with Amber. QHR was supposed to be able to support the facility, and I have a concern too that it's maybe not being utilized to the extent that it could have been. Could be. You know, have you ever sat down, like when you started, did QHR sit down and explain to you all the services that they could give? And did you ask them or inquire about all their services? So maybe that would be something that the board and Jeff should take a look at, is because the board is so new to the organization as well, maybe you should be reviewing all the services that QHR has.
We get, inside the contract, there's actually all the services that they provide for us. But again, I didn't bring the information and I can bring it next month. But it's very specific things that they'll do, and it's basically we pick and choose what we want to have done. And they came in and they did an accounts receivable audit to see where they were at so that the facility could start getting more help in accounts receivable to bring the debt down, or not the debt, but the AR down, and give the facility some cash. But a lot of the moves that were made weren't made by QHR or their recommendations. They were made more by the interim administrator and the staff. You know, they cut staff, they started monitoring what they had for volumes. That's what made the organization turn back around. It had nothing
So
to do with QHR.
when will you start looking at, if you don't think QHR is helpful, are you going to look for any other type of services to help with issues like this, or you're just gonna
We
wing
can,
it?
yeah, we can.
Or do you
Um,
think you need that? I mean,
Honestly, I don't want my opinion public right now.
There's other opportunities out there.
There
other
are
than
other
QHR.
opportunities out there. But
It's not-
it's not really my decision, it's the board's decision.
Right.
But I was just wondering when, like, you're not gonna wait.
Well, the thing
The-
of it is, if we wait until next year, like about this time next year, and QHR wants to extend the agreement, then we have some leverage against what they put in that contract. That contract is so vague, it doesn't hold them to anything, and we can't get out of it. So basically, we have to sit for 4 years.
But you don't have to sit, because the last time we started looking, like, they were looking at, you know, I don't think a little hospital is gonna be able to manage on their own. I think you need to start looking about partnering with, you know, a larger organization. And we had a partnership with, was it Sanford?
Yes.
Yes, and unfortunately, that
You had
didn't
a
work
partnership
out.
with who?
it
Sanford.
was just-
Sanford was one they first looked at, and
Right.
then they backed out.
yes.
Yeah.
Well, you know, and I believe there were a lot of other issues behind that.
Possibly was.
But, you know, I think you need to start thinking about, you know, Cncl. We send a lot of our patients to Cncl. They're looking at bringing in other organizations. You know, not that we have to, you give up a little bit of your voice, but it's getting very difficult for little hospitals to manage on their own. It's something that I think you should at least consider. When Ronning was on, they took a lot of time visiting other facilities that were run by these organizations, and, you know, we're trying to make the best decision. Unfortunately, they ran out of time. So I'm thinking, I don't think it would be the best to wait until right before the QHR contract comes up. I think you should be starting to think about, now, do you want to stay independent, or do you think the best plan for the hospital would be to partnership with someone? You know, and then if you do, I think, like, I would be out there visiting the other facilities that are using this group and, you know, see what they think of them. Did they get good results, or, Is this not something you want to do? But I just think you should start, the board should start thinking about it and reviewing their options and not wait until right before QHR. Because personally, I don't think you're going to go with QHR again. And, you know, even if they offer you a little better contract, have we really benefited from them? You know, and you need to look at all of that. What can Avera offer you if they would accept you? What would Cncl? What would Rice? You know, there's just lots of different possibilities. And there's other companies like QHR too that are out there. But I think that's not something you can leave for just a couple of months. That's a big decision, and it's going to take some time.
Right, but you got a year from now till the existing contract is out.
July.
Yeah. Okay.
Well, just, you know, Sherry, there are resources out there, resources like Minnesota, our auditors. Our auditors do everything that QHR does. So we have the opportunity to engage them, but we don't have to pay the monthly fee, which is so large compared to, we asked them to do I'm trying to think of what it's called, a charge master review. And when we got it back, it was not good. And I Bailey did a charge master review for Dawson, and it came back and it had all kinds of information as to why the charge master should go up or down. So there are companies out there besides QHR that we can partner with.
And that's why I'm saying, I
Yeah.
think you need to start looking at it now.
I've been thinking
instead
about
of-
that this whole time. It's what the board decides they want to do.
But they need to be, you know, you need to start the discussions now and start, if you're going to go looking at places, at least that's what they did before, and it seemed to be working, but, you know, we just hit roadblocks and time got short and, you know, there were a lot of things in play there. But I don't think you should be waiting until right before the next contract comes up. I think it's something.
Well, I'm talking about the negotiation piece because that gives us the leverage. It's not that I haven't been thinking about who to partner with or how we move forward. It's just that if it's QHR, so that we have a better advantage, the contract's running out. If you don't want to work with us, we'll go somewhere else.
Oh, yeah,
That's what I'm getting
that's
at. Yeah.
obvious. You wouldn't, you know, want to do that. But if you're going to look at somebody else, you know, that takes a lot of time. It takes, the board members went to other facilities and, you know, it took months. So it's just something, you know, and
And we
possibly you
still ran
might,
out of time.
yeah, yeah. And so it might be something too, you could inquire with the previous board members what their experiences and thoughts were too. But anyway, that's
Yeah,
just
no,
my input.
Okay. Any other questions on QHR? I wanted to announce that we did get a rural hospital, small rural hospital capital grant. It's going to go to our digital radiography suite. We're also going to be getting a brand new hematology machine and chemistry analyzer. And Jason is doing an article with Leslie, and so that'll be out next week. And it'll have more detail in it. From the recruitment standpoint, we're sitting fine with 4 providers. The volumes have been a little bit down in the clinic and in the hospital over the last month, but from March's financials, we're sitting with a positive variance, and you can see that by the 13%. Our bed sale is coming up on June 1st, and we got a lot of projects going on right now. The roof is about 50% complete. The humidification and air handling unit, which is part of phase 2 of construction, that is going to be set out for RFPs, I believe, next week. We have the tub room that should be completed by the end of next week, and the pharmacy and stress test area and our teleconference area should be complete by the end of this week or early next week. So there's all kinds of projects going on. And then, the pictures that I passed around, those were before and after pictures of what was being done over at the nursing home. Still, it's not totally complete, but it's starting to have a real rich look to it. And I'm getting a lot of nice comments that people like it. A couple of them that said they don't like chocolate or they don't like brown, but you can't please everybody. And other than that, we interviewed for a pharmacist. Bill, our pharmacist, is deciding to retire. And so we met with a gentleman just yesterday And he'll be letting us know on Friday whether or not he's going to accept the position or not. But he was 99% sure he just wanted to talk to his family. So those are things that are happening at the hospital. Any other questions for me?
How much was that grant?
The grant is for 98,000 something. I don't remember the exact number. But we have to throw 25% matching funds to it. So I think it's like 27,000 or something we have to pay, and we get all three of those brand new pieces of equipment.
Any other questions? All right. Thanks, Jeff.
Thanks a lot.
All right. Next item we would have, if there's any changes to the agenda. Then the next item we would have is in regards to some old business with regards to Western Consolidated Co-op and the railroad crossing. One of the things I would just like to mention to the council before I start on this one is due to my employer, I will be remaining, I will not be participating in, and I'll abstain from the vote also. So you guys will get to discuss that, and then also, when I call the vote, I'll also abstain from the vote. But otherwise, I would call for a motion with regards to that old business.
Motion to approve the request from Western Consolidated Cooperative to allow the closing and crossing of the Twin City and Western Railroad track at South Paul Street during the loading of a unit train. A written agreement is to be prepared detailing the procedures when closing the crossing.
Is there a second?
I'll second it.
Second? Discussion?
I gave each of you the letter from Donnie Fisher. Part of my frustration is Donnie's never, that I've ever known, talked to anybody about the trains. He's never said anything in the office. The other thing, after the last council meeting, I don't know who Doug got a hold of, but he got the train moved really quickly. And I also noticed that a time after that there was 3 engines, but they were on the other side of Terminal A towards Milan, so they were not parked here anymore. You know, Ronnie was in today, and we talked, and you know, he understands the whole economic thing, and my question to him is that, how many times had he called in the past? Well, he hadn't. And I said, you know, that's the key thing, is that anybody's got issue, I don't care if it's 2 in the morning, call dispatch. Call 911. And, well, not 911, they'll call dispatch then. Most people will call 911 because that's what they'll think of, but, I mean, call somebody. Don't just let it slide. So, and I'll let Harry address some of the other things that Donnie has.
Well, the ability of cities to regulate trains is somewhat limited. I mean, it's really limited. There's some state statutes, but so much of this is federal law and interstate, you know, transportation and those types of things. I just kind of made some comments going down through Don's letter to the council, and his first statement of allowing the train to block Paul Street technically would be a violation of the city ordinance blocking the public right-of-way, and in all candor, if the train just blocked it, that is true. There's a statute that the trains are not to block public right-of-ways for more than 10 minutes. I think you may have seen in the news that Benson has a number of charges there, and the railroad is apparently challenging the enforceability of that, of the statute. The statute that prohibits trains for more than 10 minutes. The statute is 219-383, which says, no railway corporation shall permit a public street, road, or street crossing a railroad track to be closed for traffic by a standing car, train, engine, or other railroad equipment, or by a switching movement which continuously blocks a crossing for longer than 10 minutes. And then this doesn't apply to cities of the first class, which would be Minneapolis, those types of things. We experienced that problem in Appleton a fair number of years ago when Herring and Munsterman were both blocked for longer than 10 minutes. But I actually lost a prosecution against the railroad when the train moved a little bit forward, a little bit back, a little bit forward, a little bit back. And obviously my argument to the judge was it could be up there till 2049 if it moved a little bit forward and a little bit back every 9 minutes and 59 seconds. Could be blocked forever. Judge said that's interstate transportation. It was moving. It had to be, for the state statute violation, it had to be continuous, not moving for 10 minutes. Now, having said that, it's not the railroad that would be blocking it technically if we, the city, permitted the street to be blocked off. For example, we don't have to have Paul Street as a through street. City council could designate Paul Street to end at the railroad tracks and begin on the other side. You have the authority to control your own street. What the theory here is that we would be somehow granting a right to block a street. And the way I was looking at it was similar to a street dance where you block the street. The block party, if everybody, Heather and I are neighbors back to back, but if we wanted to block off Herring and Miles Street to have a block party, we could come to the council and have some permit or something to do it. So I think the vision with WestCon is to have some sort of system arranged where we would permit the street to be temporarily blocked off for the unit train. We would need law enforcement and fire department and people notified so that it's clear when that is happening for safety purposes. You know, we would need those types of things to be done. There's a, if anybody ever is interested, there's a Railroads and Cities memo on the League of Minnesota Cities website that's informative, but it's also illustrative of the lack of control that a city has over railroad traffic. For example, regulation at the local level is generally rather limited. However, cities currently appear to have some ability to regulate the following areas, and one is use of locomotive horns. You can petition the federal federal agency for a quiet zone where they wouldn't have to blow the horns and those types of things, which would be mandatory. Other if you can get the railroad just to, if it's sitting there, to not blow the horn or to move the engine or to turn the damn thing off, quote unquote, for the diesel engine. But I don't think the part of Don's statement that the diesel engine running for more than 30 minutes, I don't think that could be enforced against the railroad. That noise prohibition would not apply to the railroad. But he is right that the railroad blocking the street in his first two questions would be a violation of the ordinance unless the city gave some permission to block that street on a temporary basis or to WestCon. Some of the other items are really policy decisions that are not legal decisions. He's asking about the value of residential property in residential areas. That's really not a legal decision. He's asking about emergency responders to get to the south side if the viaduct would flood. Obviously, that does happen once every, I don't know, Roman was trying to figure out when.
Well, since they redid that, how many years ago? It's happened one time? Is all. Yeah.
Once he asked about the traffic during the state fair. Well, that's 4 days. We could ask WestCon not to load a unit train during those 4 days. You know, Chad, you probably know, even though you're not participating, you know if that would be possible, but we could ask them, hey, during the fair, could you kind of maybe not have Unitrain out there during the fair?
I got the impression, though, that they didn't get a lot of voice in when and
No, they
and times of.
Right.
So we probably wouldn't, but I don't, it's gonna be for 8 hours, it wouldn't be for 4 days straight. And
that's what I
most
said,
likely,
too.
he said, most of the loading will be at night.
How are farmers with large equipment going to bypass the viaduct? Well, they shouldn't, farmers with large equipment should not be on city streets, city residential streets, is my understanding.
Or some
Well,
other
those
road.
farmers can go south by Jim Boris over there, like, I've done it many times, it's no problem, really.
So, I can't answer economic advantage from blocking Paul Street, that's a policy decision. How many employees will Westcon add that may reside in Appleton? We could ask them, but even if this increased their workforce by 10 employees, those 10 employees can live in Wilmer. We can't require, the city cannot require a private company to have their employees reside in town. We can require our police officers to reside within a call distance, like in the contract within the police station, Doug. It's a couple miles or something. 2 miles, but that's not even in town. That's for safety that they got to get here on a call. Will the police department be capable of handling added complaints? And I guess you'd have to ask the chief, but I would say yes. I mean, that's what they're there for, to respond to complaints. So but that would be something for the chief to do. So the one area that is truly a legal question, in my view, is the blocking of the street without consent would be a blocking of a public right-of-way if we in fact allow Paul Street to be blocked temporarily at various times, then it's with our consent and it's not a public nuisance.
Just on the flooding, was there ever a time when it flooded so badly that a fire truck or the ambulance couldn't drive through it? It was just like a regular car probably wouldn't want to, but.
Yeah.
Yeah, but otherwise our emergency vehicles could still get through the flooded. Right, okay. The only concern I had was the noise. And I guess as long as Westcon knows that if there's noise issues, they're still gonna have to respond to those complaints.
Isn't that something you can request though ahead of time?
Well, the problem with noise regulations, Amber, is that, again, reading from the manual, state noise regulations are generally not enforced against railroads. However, the Minnesota Pollution Control Agency measures noise from railroads to